Hi, I'm Dr. Greco, and today we're going to talk about ticks and tick-borne disease and what the symptoms are and what we do about ticks. So first, I'd like to fix something that a lot of clients say to me that is incorrect. Ticks are not just a summertime problem. Anytime the weather is over 40 degrees, there are ticks. So even in the winter times, a lot of times we get warm snaps where we'll have weather that's in high 40s, low 50s, and that is a time when a tick will be hatching. Okay, so even in the winter time, we can have ticks. So we recommend year-round prevention of ticks. The newer tick preventatives, including Brevecto, which is the one we carry primarily, kill the ticks very quickly. So that's half the battle because ticks need to be on your dog and feeding to transmit a disease if they do carry it. The three tick diseases we tend to have in this area are Lyme, Anaplasma, and Ehrlichia. Anaplasma, some of the studies say that the ticks only need to be on and feeding on your dog for less than a half hour before it can transmit anaplasma. So it's really imperative that you have your dog on a flea preventative that kills fast. So I've gotten away from the topicals like Frontline. Frontline takes way too long to kill the ticks. It takes at least 24 to 48 hours to kill ticks. And by that time, you could have so many things being transmitted. So I'm much more in favor of the newer preventatives like Brevecto, NexGard, Simparica Trio, Credelio. All of those would be good options. We carry Brevecto chewable, topical, and now we do have a once-a-year injection, which is very nice. It takes away the remembering to give it, which I think is a big problem for a lot of people. It's very safe. It's been well tolerated. We've been using it for about a year now, giving it with vaccines in conjunction on the same visit and doing well. My own dogs have been on it since the minute we got it in stock. So that's the preventative part. Preventing the ticks is usually pretty easy, but sometimes we live in certain pockets of the Fairfield are very tick heavy. And even if a dog's on one of the good preventatives, we'll still see ticks crawling on them. So there are options to add things like Seresto, which is a collar that helps to deter. So that's giving you a deterrent as well as killing the ticks if they get on your dog. So sometimes those things need to be combined, especially in a heavy tick area. We do have a lot of clients that go to the Cape and the ticks are really bad out there. So often we're saying, hey, put a Seresto on in addition to get that deterrent effect. So tick diseases, back to tick diseases, we have Lyme, Ehrlichia, and Anaplasma. We routinely test for those once a year. It's included with the heartworm test. What the test is telling us is that we were exposed to the disease and we made antibodies. So it's not telling us if you're gonna get sick, but it does tell us we were exposed. So there's a lot of debate amongst veterinarians about what to do if you have a positive test. What I tend to do is err on the side of caution. I recommend in a first time positive, we do a treatment course of doxycycline because that's a very effective antibiotic against tick disease. And then there's other things I recommend. I usually like to check some regular blood work, make sure we're not having a lot of these tick diseases can cause abnormalities with different blood cell lines. So a lot of them can be anemic. It can cause a low platelet count. It can cause an elevated white count. And then the other thing we check is urine because sometimes tick disease can target the kidneys and sometimes the first place you're gonna catch it is in the urine. So usually those are things I'm recommending we check on as well. By and large, tick disease is pretty treatable in dogs. We used to have a lot more trouble with Lyme nephritis, which is a really bad kidney infection, and Lyme encephalitis. We really don't see that anymore now that we have a really good Lyme vaccine. So we really don't see that anymore in dogs that are vaccinated. So obviously of the tick diseases, Lyme is the only one we have a vaccine for. It is a very good vaccine. What it does is if your dog does get bit by a tick and Lyme transmits into the dog, the vaccine goes and neutralizes that bacteria. So it is very effective. It's pretty safe. I've been using it a long time, and maybe like 10, 15 years ago, we were having a lot of reactions, but we really don't anymore. So I think as far as like the typical symptoms I'll see in a dog that has tick disease and it's actively sick from it. More often than not, they're coming in telling me, oh I feel dumb making this appointment, my dog's just off, you know. But sometimes it's just mild lethargy, sometimes they're not eating as well, they don't want to play, they don't want to go for walks, you know, so there might not be any big obvious symptoms, but it's just that general malaise that people come in for. And often the frustrating part is you'll do a bunch of tests and they come up normal. You know, sometimes the dogs aren't feverish, their blood work looks pretty normal. I've even sent out tick panels and they're normal. So my gold standard, obviously, if I have enough suspicion, is I trial them on the medication, the doxycycline. And more often than not, we're seeing a big turnaround within 24 to 48 hours. And that tells me what I already knew presumptively, is that we're dealing with tick disease and we need to treat that. So, but definitely pretty prevalent. So we're in mega tick area. So if you have questions, please give us a call. Come in if you have any suspicions, if you're worried, and make sure you keep your dogs on the flea and tick preventatives.